we are down to the wire. It's the last 3 Chamber EDU Business 101 series webinars. And again, my name is Kristine Brown, Director of Member Engagement at the Reno+Sparks Chamber. It's been a great time hosting all of these calls all through this month. We've had some great responses. We've had some great questions, some great engagement. So I fully expect that these last 3 calls will bring us just as much, if not more. It's great to be here for this session in particular with Valerie Clark and Melissa Davies from Clark & Associates, who have been an incredible resource, not just to us at the Chamber, but in the community when it comes to providing care and benefits that employees in our community need. I know as a Chamber employee, I am a direct beneficiary of the work that they do, and I greatly appreciate everything they do for us and for our community. And so it'll be great to have them talking to us this morning about resources for employee mental health. I got a sneak peek at the presentation, and it's definitely a good one. So we're in for a treat today. The last 2 sessions that we have this week, tomorrow we've got Capturing the Sale Through Good Writing, which should be an incredible session. I'm really looking forward to that. It's a topic we don't really discuss very often, and I think it's incredibly important. I think we make a lot of assumptions that, you know, if we can put a couple letters together, maybe we're a good writer, but of course there's a lot more to it than that. And so, you know, regardless of whether you consider yourself a trained writing professional or a novice, I think it's always good to brush up your skills. Keeping your virtual team engaged. Again, that's another one that we're happy to partner with Clark & Associates and Solutions at Work to bring you, and that will be on April 1st. And then after that, over the next 2 months in both April and May, we've got some cool programs going on. We've got our Green Business Training and Certification Program for our members. What we know from many studies that have been done over the course of the last couple of years is that not only consumers but employees want to engage with companies that care about the environment. And so this is a really simple, low risk way to get your skin in the game when it comes to environmental practices. We're hosting meetings every week from April 15th to May 20th from noon to 1. We're giving you free food. What could be better? And at the end of the course, you will have the opportunity to be Green Business Certified in the state of Nevada, which is a great stamp of approval to have. And we encourage folks to participate in this free training. Also, the HR Bootcamp, which is one of our signature programs. We've offered it many, many years. We're proud to bring it to you again in partnership with the Northern Nevada Human Resources Association. HR Bootcamp is going to be taking place all through the month of April, most weeks, not the first week. We're going to skip a week and then start on the 8th, but we've got 4 sessions to bring you the latest and greatest in policy, onboarding people, retention, how to set goals for your employees, conduct reviews properly, and help them improve performance. And then, of course, capping it off with changes in HR due to COVID-19, which is incredibly important, especially as vaccines are becoming readily available. And employers, if you haven't already, now is the time to be coming up with those policies. So with that, I'll go ahead and exit out of my screen really quickly and toss things back over to my friends Valerie and Melissa, who are going to bring us today's presentation.
All right, thanks, Kristine. Let me just get this up here. All right, can everyone see that?
Looks great.
All right. Well, welcome everyone. My name is Melissa Davies and I'm with Clark & Associates, and we're excited to present on this very important topic today. I'm a benefit solutions consultant for Clark & Associates. Been with them for 14 years now. And I also have a degree in health science from UNR. And I'm proud to do this with Valerie Clark, who can introduce herself and all her expertise on this subject as well.
Great, thanks, Melissa. And it really is a pleasure to be with the Chamber. The Chamber for many, many years has been near and dear to my heart. Have had some exciting times throughout the years. Yeah, my background is similar. I come from a very healthcare oriented background. I went to nursing school, have my bachelor's degree in nursing from Loma Linda University in Southern California. And after a 10-year career in school nursing, psych mental health nursing, occupational health nursing, and public health nursing, I joined the team here at Clark and Associates 28 years ago, and have really entrenched myself in healthcare as it pertains to the payment of healthcare insurance, which has been a very well-rounded view of the whole entire topic of healthcare. And my passion is mental health. That is my background in nursing, and I believe it is critical, even in this time now we are so focused, but it is very critical for employers to get in the boat now and have this conversation about healthcare. So Melissa and I will present some slides to you of our feelings and resources that are available, and we welcome your questions and anything else, anything we can do to assist employers or their employees out there with resources. That's our goal here today, to provide that to you. So really, let's start with the basics. What is mental health? I think we all are pretty clear that it really is about how we feel, how we act, what is going on for us in terms of our emotions and how we are relating to society and our families and our workplaces. It can change over time, as we are very, very acutely aware of right now. Mental health can change when situations change. You may go through a divorce, you may go through a death in the family, a birth of a child. And now more than ever, as we've seen with COVID-19, our life has changed, and that really does have an effect on our mental well-being. And it is something that shows up not just at home, not just when you're by yourself, but it shows up when you're at work as well. And it's time, I think, for that conversation for all of us to have, especially us who are employers. How do we deal with the topic of mental health? So according to one study, there's millions of studies out there. As I was putting this together, I really had to choose a few of the many that I saw. But behavioral health has been identified by many, including one good study that CVS put out an article on, as one of the biggest healthcare trends to watch in 2021, and there is a looming mental health crisis. And that's very important that we pay attention to that. GoodRx released some very interesting data about anxiety medications and also other mental health medications. Their data shows that 63% of people who were getting medications have said their depression or symptoms of anxiety have worsened since COVID took over. Just a few statistics that I thought were very, very interesting to sort of set the stage for us. An estimated 51.5 million Americans, or basically 20% of all Americans, experience a mental illness in a given year. Less than 50% of those with a mental illness receive treatment. That's very important information for us as employers. Serious mental illness costs the U.S. $193 billion in lost earnings annually. Another important feature that employers really need to be aware of. Suicide, big topic. It's the 10th leading cause of death in the U.S. 90% of those who die by suicide have an underlying mental illness. Depression is the leading cause of disability worldwide. That's an important statistic for employers to be aware of. And approximately 10 million adults have co-occurring mental health and addiction disorders. Very critical statistic as well for employers, as our goal is always to have a safe and healthy workplace.
So there was a recent study published by the Journal of Occupational and Environmental Medicine just this past February of 2021, saying 38% of American workers surveyed experienced low levels of energy, poor sleep, or a feeling of fatigue during the past 2 weeks at work. I mean, I don't know about everyone else on the call, but I think over the past year, especially, I've definitely experienced low levels of energy and lost sleep, just because of feeling so out of control because of everything going on and not, knowing whether or not my kids are going to be back at school, or if my family, will be okay after all this, and, just all the stressors that have been going on. So it's definitely an interesting time and important that we're talking about this. More statistics from the American Institute of Stress from 2021. Nearly 80% of Americans consider their job stressful, and 46% of employees reported that their workload was the biggest cause of their workplace stress. 1 in 4 employees view their jobs as the top stressor in their life. Obviously, work is called work for a reason, and your job is going to be stressful. So it's not possible to eliminate job stress entirely, but there are some tips and some tools that employers can use to help their employees manage the stress more effectively.
And Genentech has Deborah Olson, who is their lead strategist of well-being. She came out with a very interesting statement that really hit home for me, which is that COVID-19 has put a spotlight on mental health in a way that it can no longer be ignored. Everyone is somewhere on the scale, whether they are thriving or having difficulty getting out of bed. For me, treating mental health needs to be on the same level as treating shoulder pain. And that is, I think that is a critical statement by someone in a high level position with Genentech. They're a pharmaceutical company here in the US. And they're finally coming out and publicly stating that we have to treat mental illness the same way we would treat any other type of illness or disease. It is part of the full well-being of a person. It affects you personally, and it also affects your workplace.
So here are some signs of employee burnout. Increased absences or more days requested off of work. Disengagement, maybe not connecting with their coworkers or wanting to really be engaged. Exhaustion, emotional, mental, and physical fatigue, having a hard time focusing. Increased mistakes or accidents, again, kind of toward, not having that focus. Withdrawal or isolation, like I said, not wanting to collaborate or work with their peers. And a higher sensitivity, maybe they're a little bit more emotional than usual.
So the question lies, what can we as employers do? I think over the last several years, we've been through a lot as a country, as a community. As employers, we've tended to possibly not want to dabble in this topic, but based on what we're seeing, based on the slides that we've already presented, we feel it's time for employers to start to become more engaged in the topic of mental health, mental well-being of their employees. So what can an employer do to protect not just your workplace, but also protect other employees that you have and assist the employee who may be experiencing a mental health crisis? So that's what we'll dive into next.
So here are 4 topics or ideas that employers can be aware of, which we'll dive into. Promote mental health awareness. So promote that, that it is something important to them in their workplace environment or workplace culture. Address workplace stress, and then evaluate your benefit offerings to see if there's some offerings that can help employees. And then train managers and supervisors.
So we'll go into each one of these in a little more detail. What we mean when we say promote mental health awareness, first, we want to create an environment that is free from the stigma of mental health. I think for a number of years, we've not wanted to dabble in that topic. There's been a stigma associated with it. You're crazy, and the rest of us are fine. That's just not the case anymore. We need to eliminate the taboos that people aren't normal if they experience low points or depression. It's really about promoting a company culture, understanding that mental health is part of physical health. We want written and unwritten behavioral norms and expectations, that we want people to feel comfortable and safe, that it's okay to be a normal, regular human being that may have depression at times or have low points or have trouble with possible addictive behavior. There's creating that safe space for our employees to be truly the human beings that we all are, I think is the first step. We want to communicate the importance of mental health awareness. Eliminate the shame in asking for help. If someone needs help, we want them to feel comfortable asking for help. We want them to feel that they're not going to be ostracized if they convey a feeling or a need that indicates that they're struggling. And we want to encourage our employees to prioritize their mental health. Nowadays, now more than ever, there are benefits and resources available to employers and employees that weren't available 10 years ago. We've had laws that have been passed that have made mental health coverage on par with all the other benefits in a health insurance plan. And the amount of resources and services available now to assist people with mental health has increased dramatically. And we'll go into that a little bit more in another slide. And then check in with your employees. We want to make sure our employees know that we care about them, because by checking in with them and asking them how they're doing. Showing care and concern is probably the number one thing we as employers can do for our employees. And just like Ron Crawford, who is the Vice President of Global Benefits for Starbucks, said, we launched a mindfulness and meditation app with the primary goal of diminishing stigma around mental health. And we've found that it transformed the ease with which people talk about their health. It was a great stepping stone to encouraging people to be more open about seeking additional support. Such a minor thing, but it created a safe space and an avenue for employees to feel comfortable and more supported about this issue. Also, when it comes to checking in, we want to talk about workplace stress. It's really another important topic that we as employers want to acknowledge with our employees, that the situation at work, if it needs to be addressed, then we as employers should address it. We want to check in. We want to make sure workloads are appropriate. We want to meet regularly with our employees to facilitate that communication, that back and forth. Are you okay? Is your workload affecting you? Is there something I can do to help you get through the situation in a way that isn't affecting you negatively? If there's anything going on in the workplace, bullying, discriminatory behavior, we want to nip that right in the bud. We want to address it quickly. We want our employees to know that we support a healthy, happy, and positive workplace. Recognizing and celebrating each employee's success is a great way to show support and increase the mental health of our employees. Create a flexible work schedule. If there's anything we can do to that doesn't affect the company in a negative way, to make things more workable for our employees, we want to at least explore that. Speaking for our own company here, throughout COVID, we have several moms who need that flexibility to be able to either bring their kids into the office sometimes or work from home. And sometimes, and Melissa will attest to this, you know, she's sitting there doing her work, and at the same time, she's supervising her kids who are on their own Zoom call within 2 feet away from her. And I think I remember a few of those times. But we, you know, as an employer, my company here, we felt a great amount of success because we were able to create some flexibility for our employees, and work could get done and still achieve the goal of supporting our employees as well.
So we mentioned evaluating benefit offerings. One thing, of course, is an employee assistance program, or an EAP. This is a lot of times something that can be purchased on its own, or can be included with disability and life insurance at no charge. But it provides either a phone number or face-to-face visits that are anonymous. The employer does not get any reports on who used the program, but it can help them with anything from substance abuse, stress management, financial issues, estate planning, resources for caring for an elderly parent. It's just kind of a one-stop shop for helping them with those life stressors. Another big option that's very important these days is telemedicine. So telemedicine definitely has gained popularity over the past year. Being able to access your primary care doctor through mental or telemedicine has been very helpful, but most of those offerings do allow mental health. So you can see a therapist or a psychiatrist through the telemedicine, and have it be private, not have it be a doctor you could run into at Costco on the weekend. It's definitely a huge benefit these days, in keeping things confidential too. Another resource that we've recently come across is an online resource for meditation or classes to talk about healthy living. There's just all kinds of new benefit offerings coming out these days, and so definitely encourage you to explore those if you're looking to expand your benefit offerings.
Another important thing that we want to do as employers is we want to train our managers and our supervisors in a proactive way to be aware of the topic of employee mental health, not just being aware of it, but how to deal with it, how to manage it, how to be proactive when you feel there's something going on. A few topics that are important to remember is that there is the Mental Health Parity and Addiction Equity Act of 2008, which basically provides equity and requires group health plans to cover mental health and substance abuse disorders as they would cover any other disorder. So that is a very, very important benefit that we tend to forget sometimes, but you do have that ability, if you have an insurance plan, to get these the mental health care and substance abuse care as if it was any other illness. So we want to make sure our people know to encourage our employees to use that benefit. And then, just detection and response training. We want to train our management team how to recognize the signs of mental illness, stress, strain, anxiety, anything, workplace bullying, so that they can respond quickly and proactively. And we want to have, adequate policy and procedure, and even explaining to the employees that it is there and available. And, the whole goal is to have a healthy and happy workplace. And if there's any issues, there is a process to deal with that. And if you have a safety group, you can have your safety group focus on psychological wellness and educational training and ways to deal with these topics to, again, make your workforce happier, healthier, and safer. And just in wrapping it up, we want to make you aware that if you need, as an employer, if you need tools and resources, we have a plethora of them. A lot of brokers do. These programs are readily available to us. A lot of it is no cost. Some of it does have moderate cost, but the majority of resources, tools, and information and programs are available at a very affordable price. And your broker should have it. We for sure do have it. If there's anything we can provide to you, infographics, policies and procedures that are already pre-written out for you, articles, anything you would like, we have a plethora of information and we're happy to share it with you.
So with that, if anyone has any questions, we have our contact information on here. So you're welcome to contact. We've got our email, which goes to both Val and I, and our phone number here. We'd be happy to provide any of our resources to you. If you're looking for any information, please reach out to us and we're happy to send that over.
Thank you so much to you both. This was a fantastic presentation, and I realize it likely just scratches the surface of your expertise and the things that you've encountered as you've been working with businesses, and the benefits that they provide. I'm sure you've seen everything under the sun. I thank you for sharing just a little bit of that with us today. I think what continues to ring true, not just because of COVID, but COVID has definitely shone a light on this, is that we need to be good students of each other and to be curious and to take time to notice other human beings and what they're going through, what changes they're undergoing, in order to identify, where someone may be struggling, where someone may need a little bit of help. I think one of my big questions, and I don't know if it can be answered here, but I think, in managing people in the past, I think one of my big fears or big questions was privacy. I think there's a fear of, if I check in with someone, if I know something is wrong, what can I ask? What can I not ask? When is it crossing the line? At what point, at what point do I reach a moment where all I can really do is refer someone elsewhere in order to get help?
Yeah, I mean, that's a really, really good question, Kristine, because we are well aware that there are privacy laws that are very, very important to follow. And I think this is where a good human resource department, good human resource guidance comes into play. You want to have very clear policy and procedure about how you technically handle these situations. And you want to have well-trained HR people, HR representatives who understand the need for caring and concern and also privacy, because that is critical. And I think, again, training is probably the best thing you can provide to yourself as an employer on how to best do that. And your corporate culture, your company culture will dictate a lot of that too. If I use my own office as an example, we happen to have a smaller team, about 10 people, but we've been together for a long time. I mean, the newest person is almost 2 years old. And and the oldest person, well, that's myself, I guess. I've been here 28 years. But I mean, we foster an environment where we almost are like a bunch of sisters. We are almost all women. We have 2 guys, and they fit in too. We love them to pieces. But we have this culture of support. A lot of us are moms. A lot of us, have that 20 balls in the air, and we're in a service industry. So we get the stress. And so we try and foster that support. everyone knows their culture, and good, solid HR advice and support and policies and procedures combined with a really positive culture, I think is really the key to surviving and getting through these times, and focusing properly on good mental health.
Excellent. Thank you so much. I mean, good HR professionals are arguably one of the best resources that we have. We know that people matter, and people who are focused on people matter. So thank you
Right.
for sharing that.
Can I ask a quick question?
Of course, yes. The floor is completely open.
Perfect. So I'm with ABC Nevada. We're a trade association, and my role within the organization is I'm developing a leadership institute. And it will be a year-long program for emerging leaders in the construction industry. And I'm currently working on the curriculum for that. And one of the topics that I want to address is what's being discussed today. And a lot of it is just human resources issues, and exactly what Kristine was asking, what questions can you ask, can you not ask? My question is, do either of you either know someone, or would you be interested in participating in this leadership development forum and speaking to emerging leaders about these topics? Because I know we kind of joke around, it's the soft skills for the hard trades, and those are the things that are sometimes missing that are the most important. And so I'm looking to bring in, experts in the industry that can help guide these people along.
Yeah, if we can't help you, we know plenty of people who can, but we're happy to be a resource for you, Stacy.
That would be amazing. Amazing. So is that the hello@Clark&Associates? Is that your email?
That's Melissa and myself.
Okay, perfect. So I'll go ahead and shoot you guys an email, and then perhaps we can set up a call and talk a little bit more. I would love to pick your brains a bit, if you don't mind.
Sure. Yeah, this is a topic near and dear to our hearts. Me personally, I've been in this business since before I was out of high school in one way or another. So it's a very, very important thing, and I'm grateful that it's coming out finally.
Yes. It's one of the perks of the past year, after everything that we've gone through, you're starting to see, there are some benefits to it. And one of them is mental health is openly discussed now, and everyone struggled on some level, and it's not a weakness. But when you're in a management position, you have to make sure you're balancing being human and following the law. And, it's a balancing act.
It is. It's easy to kind of get onto a slippery slope with it, but I think really good policy and procedure combined with just a kind and caring attitude, I think will get you a long ways.
I agree. I agree.
Also, if you do have some of those resources, in your benefit wheelhouse, like the EAP or the telemedicine, where it's included with your medical plan and they can access. Calling and talking to a mental health provider, just making sure that they're aware of those resources too.
Yeah, it's a great door opener with your employees. We, in our benefit meetings with our clients, a lot of times will say, you guys, if you need to see a counselor or talk to a counselor, some of them are no charge. It depends on your health plan, but some of them are no charge. Some of them are just the cost of a doctor visit copay. But this is such a great thing. If you need to talk to somebody, this is free. Take it and use it. And you as an employer saying that, it says a lot to an employee that it's okay.
Absolutely. And I think, it varies. Our members, we have some very, very large contractors within the state. And then we also have some real small mom and pop companies that, aren't able to offer that type of insurance option to their employees. And I think just knowing what the signs are to look out for. And I hear a lot from people too, that it's that balance of compassion without enabling. Making sure, productivity is occurring, but that people are taking care of themselves. And that's, again, this is all a balancing act, especially as our world is still shifting so much. Right.
Yeah, the glass is always half full.
Indeed, there have been some incredible lessons learned in this past year, and I'm really pleased to see that this connection is being made as well. Since
Me too. Thanks, ladies.
we're connecting people, so I'm really pleased that that Stacy, you're finding a connection that's vital to you here today. I want to address, I think, something that you touched on in some of the early slides, and that's the fact that there's almost a sense that there is a looming crisis ahead of us, that we haven't even really scratched the surface, that once people get a chance to take a breath, then they may actually know where they are and whether or not they need help. And at that point, it may be too late. And we may be seeing, a rise or a fall rather in workforce participation rates, people taking leaves of absence because they need a break. What are some of the other things on the horizon that we're seeing as larger trends as we come out of COVID when it comes to mental health?
One thing I've actually heard of is, a lot of people have been working remotely or been somewhat isolated, and there's anxiety about returning back to work or being around people in person again, or going to, networking events again. So there's a lot of, I think, anxiety going back out into the public, that's going to kind of present itself.
Yeah, another one I think that we are going to get slapped in the face with fairly soon is financial health, which is it dovetails right into mental health. I think a lot of people have sort of put off the financial things that you normally would do. Maybe they're living paycheck to paycheck now more than they ever did before. Maybe they've spent a lot of their savings dealing with COVID in one way or another. And at some point in time, and who knows, I think we're not going to be getting stimulus checks forever. I think financial wellness is going to tie right into this as well, and is looming on the horizon. How we deal with that, I'm not quite sure yet. It hopefully will present itself. It'll manifest in a way that we can deal with it over time. But I think we have to keep an eye on our employees' financial health as well.
I agree. I mean, we're looking at, I think the CDC just reinstated the eviction moratorium at the federal level. Mm-hmm. But again, an eviction moratorium is not the same as rent forgiveness. And we've got,
right.
Thousands, maybe millions of people who are going to be facing a pretty scary future when some of those moratoriums lift. So I think you're right. I think financial wellness is key. As it happens, I'm working on a project right now to try and bring financial literacy classes to chamber member businesses. So I'm heartened to know that there is an acute need for that, and that could fill a void that needs to be filled.
Yeah. Yep.
I was just having this discussion this morning actually about the eviction moratorium, and like all of these issues, they're so complicated because the tenants may not need to pay rent right now. They're going to have to pay down the line, but the landlords, they still have to pay their bills. Yep. And if they're not getting the money in, so I think we've got a rough road ahead for a lot of people.
Yeah. I think we need to be realistic about that. So Kristine, thank you for your focus on those efforts as a whole. I think it's really a nice thing that the Chamber's doing to do that. And looks like you guys are over there at the ABC as well, Stacy.
We're getting there. Yep. It's a good opportunity. It's a good time for it. There's a need for it. And I think as associations, that's our purpose.
Yeah, somehow as brokers, we tend to we operate on the fray. We're kind of there to assist people like you guys. So we do get resources brought to our attention as well. So we'll definitely, if we find things that we think could be helpful to you guys, we'll definitely bring them forward to you.
That sounds fantastic. Thank you. I mean, you say that you're out in the fray. I almost feel like you have your finger on the pulse. That's
well, lately we've been a little closer, haven't we, Kristine?
Yeah. I think we'll go ahead and leave it there and get to the rest of our days. But Again, thank you to Val, thank you Melissa for being a resource. Thank you Stacy and Darcy for being on the call with us. And again, all of these calls are always posted to YouTube after the fact. They can be watched, they can be rewatched, they can be sent to people who need them. So please take advantage of that ready resource for you. But with that, let's take care of ourselves and each other and have a good day.
All right, you too.
Thanks
Take
so
care,
much,
everybody.
ladies.
Thanks
Have a
all.
good day.
Bye-bye.